Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the corset body lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Good morning, Dr. Moya.
Good morning, Brittany.
How are you today?
I am very good. Looking forward again to a wonderful podcast.
Good, me too. All right, so something that I think needs to be addressed is the types of procedures after a procedure, such as a revision or secondary procedure, things along that line. Say, for instance, somebody has a corset body lift and there's a little area that needs touched up, so to say, or some other extended parts of the body. What do you go over with patients as far as that goes?
That is a really good question, because that is, I think it's a little bit more in depth when it comes to how I break that down. And I guess to quickly summarize that, and I'll expand into that, is when I look at doing a procedure after the original primary surgery, such as, let's say, the corset body lift, if a patient needs a revision of that procedure, what exactly is that? Well, I consider a revision really a procedure that is done to improve the scar. If a patient ends up with a scar that we don't like, either a wide scar or maybe a depressed scar, because maybe the patient had a little bit of fat necrosis and ended up with a small area of delayed healing, and it led to a depressed scar. So something that doesn't look right, that's affecting our original procedure, then I would do a revision. Another revision might be a dog ear. I don't really talk too much about that because really technically we don't get dog ears. Dog ears technically is a technical issue, meaning that would be on my part. Why did I end up with a dog ear?
Right.
But it can still happen sometimes. A very, very, very few cases that I may ever see that in at this point. But that would be a revision too, because that would be something that shouldn't have been there to begin with. And so that is a revision. And why do I call it a revision? Because it's something that affects cost. When we have to do a revision for an original procedure, we only charge patients for supplies. Basically, my time has already been included in the original procedure. So that is why we call that a revision. Now, there are cases where patients will need a secondary procedure, and we'll stick with the corset body lift because that's such a comprehensive procedure in and of itself that usually we don't have to do a secondary procedure, meaning it addresses so much skin from all different areas that the waistline stays stable throughout the healing phase, meaning there is really no loose skin that the patient will experience post-op where they say, wow, this is still here. But, and I say but, there are a few patients where they have so much loose skin, maybe they have a number of skin rolls, or maybe they're still a little bit higher on the body mass index. It leads to skin quality that has been stretched to the point where even with a corset body lift, I pull skin everywhere, things look great right after surgery. Maybe within just a few weeks even, it looks like, hey, it looks like I'm having a little bit of a loose skin in an area. Might even look like a little overhang on the lower tummy. Is that going to go away? It might be part of the swelling, part of the way they heal. But if it doesn't, and we say, wow, you ended up with a little loose skin there, we don't leave that there. Of course, we can fix that, but that's not considered a revision now. That is going to be considered a secondary procedure. And again, I call it secondary procedure because it's not anything that I did or anything that the patient did. It's their body.
Right.
It's just
their skin quality.
It's their skin quality. So, and we call it still a secondary procedure, not redoing a procedure, because again, cost is affected. Usually that type of procedure requires minimal amount of time to fix it. Sometimes I still need some general anesthesia, depending on how much we have to remove again. But that is at a reduced fee because we don't have to require a lot of time to fix that as the original procedure. So I call it a secondary procedure.
Okay.
And then there are patients who require what I call a completion procedure. So again, let's stick with the corset body lift. The upper chest incision excises all that extra skin along the lateral chest a lot of times along the upper back. But then patients can still have loose skin around that upper back area because the corset body lift is not designed to remove all of that. It's designed to remove as much as we can that's impacting the waistline in the front.
Right.
So for those patients, if they were to say, hey, I'm really happy, but I still got this loose skin along my upper back, I need to have that revised. I would tell them, no, you need a completely separate procedure. So in that case, I would call that a completion procedure because the corset body lift has extended into that part of the body. But in essence, it is a separate procedure.
Right.
So for them, they would need a back lift. Okay. So, and I know that gets confusing in the terminology, but I break it down that way to help patients understand why we do certain things and how we're going to fix it and how it affects what it costs after surgery.
Yeah, because some patients think that it's all included, or this procedure addressed this concern for this patient. So why didn't it address it for me?
Correct. And everybody's completely different, meaning from their, their shape of their body, the amount of loose skin they have, the quality of their skin, all that impacts what the final result will be. The good thing about us at this point, doing this for almost 20 years, we've become, I don't want to say aggressive, but we're very comprehensive in our approaches. So the procedures, when we say arm lift, thigh tuck, corset body lift, they're very comprehensive. So it will completely address the issue at hand. So if somebody's issue is the arm and the underarm, it's going to take care of it completely. So if something is extending from the underarm to the chest, that may need another procedure, right? If something is extending onto the forearm, that may need another procedure, let's just say. So, but we're at the point where we've done this long enough that at least I feel when we set a plan, it's going to address the patient's concerns specifically. So that's kind of where we are. And that's kind of why I broke it up into these 3 different types of approaches post-surgery. So to make it a little bit easier to understand for patients.
Right.
At the end of the day, we're just here to make people happy. But time is money, unfortunately. There's charges everywhere for people that who have to help, or the anesthesia, or the operating
supplies.
Room. Right. So can we do this under local anesthesia? Do we have to have a anesthesia person come in because it's a little bit more comprehensive? Again, that affects cost. So we're here just to try to make it as simple as we can and take care of an issue so patients are really happy.
Right.
That's what matters most.
Yes. And then time frame as to when these revisions, secondary completion procedures can be done. Typically, how long after their original procedure?
That is a great question. For all of them, we're going to wait at least 9 months.
And why is that again?
Let the scar mature. What is it? Can it change? Can it actually look better over time? Can it pop up rather than be depressed? Are we going to have some more loose skin around the area?
More settling.
Yes, more settling. Why would we go do something early and all of a sudden now you're still settling, and it affects what the second part of the procedure might be? So we need to know exactly where our final endpoint is before we decide to do any one of those.
Right.
So it's at least 9 months. Some patients, it could be over 12 months.
Okay. That's a lot of fabulous information. Thank you so much.
Well, thank you very much.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.